Hello, Dr. Hiley. Thank you for taking the time to meet with me to discuss my client and the phonological analysis that I've administered for him, as well as the case history and the management plan that I've created based on his overall needs. So to begin, I thought that we'd start off with a little just brief description about Rocky and a little bit about his history. So Rocky is a 4-year-old, 11-month boy, and he was referred to the clinic due to intelligibility concerns from his parent and his teacher. He is in pre-kindergarten right now and will be advancing to kindergarten. He has there are no concerns regarding his academic achievement at this time. He's progressing just fine, but there have been concerns that it is hard for him to communicate with his teacher and the peers that are around him. And although it's not affecting him socially at this time, mother and teacher are both concerned that in the future it might. So Rocky is 40% intelligible at most by familiar listeners, but in unfamiliar contexts and by an unfamiliar listener, he is up to 16% intelligible, which, as you can see, is a pretty big severe delay, and it's affecting his communication needs. He also demonstrates consistent cluster reduction, substitution, and deletion errors at the word level in both the initial and final positions. And then we can also see some phonological processes such as cluster reduction, cluster deletion, final consonant deletion, some lingering processes that should have already been resolved by now. So that is a little concerning. Additionally, he demonstrates an extensive and consistent phoneme collapse for both the D and the T in both initial and final positions, and he's seen to substitute most of the fricative sounds that should be established or emerging at this time. He's substituting those with the D and the T. And so for those reasons, I have came up with overall goal, and the overall goal for Rocky at this time is to improve intelligibility, to aid his communicative intents. And the following objectives are also made for him. So objective 1A and 1A2 both address phoneme collapses, and that is for Rocky to improve in the D as in dog phoneme collapse in all positions at the word level with 30% accuracy given maximum support, because he is going to really need that support at this time. And objective 1B will target the process of final deletions, and it will be to reduce the process of final consonant deletion, as in producing car instead of ka. And then the final objective, which is objective 1C, will address cluster reductions. So Rocky will reduce the processes of cluster reduction and fewer than 40% of occurrences during structured therapy, giving minimal support. So for these phonological processes, we want him to see from going from peasant to present. And so based on his needs and his overall history, I've decided to implement an integrated phonological approach to intervention that incorporates both the multiple oppositions approach and the metaphonological approach, and it'll be used for both phonological and language impairment to target his intelligibility, as well as the phonological awareness skills that he may be lacking that may be contributing to some of these speech sound errors that he is observed to see. So for the multiple oppositions approach, I chose this approach because I think that it will increase intelligibility, and I will focus on using those fricative sounds such as the sh and the ch and the j, and also the voiceless th. And he is stimulable for some of those sounds, but he is not for others. And so I thought that this would be a good approach to use in a cyclical way so that he has opportunity to use these sounds in a variation. He also this approach is also going to be used because it's also shown to have the greatest system change in the shortest amount of time. And because he is almost 5 and he is almost going to be in kindergarten, we really need to try to help him change his phonological system and increase that phonetic inventory as fast as possible. So we want him to be confronted with various within and across classification sounds, so he's exposed to them and we can address them and contrast them. Additionally, using those fricatives has been shown that it might be able to increase the accuracy of stops. And we've seen in his phonological analysis that he does demonstrate stopping, he demonstrates backing and fronting, and so maybe this will really help him develop those sounds and stop those processes at the same time. Lastly, the multiple oppositions approach is also used to target the cluster reduction, and cluster reductions are really impacting his intelligibility because he is deleting that second consonant most of the time. And then the metaphonological approach, I want to integrate that with the multiple oppositions approach because I really think that he needs that extra phonological awareness emphasis in his therapy. I want him to increase his phonological awareness skills because I think that this is impacting his ability to really tell and segment and blend sounds together. And if he was able to increase his segmenting and blending abilities, he might be able to produce those initial and final consonant blends that right now he's just not getting, or he's absolutely deleting. I also think that it will increase his opportunity to really tell that there is that final consonant there, and that does and should that sound should be produced when it's expected. And so I think that focusing in on those phonological awareness skills will really, really help him and be beneficial for him. It has been shown also that, pairing speech sound disorder therapy with phonological awareness therapy and literacy improves overall speech sound disorders. The outcomes improves the outcomes of the speech sound disorders. And so I think that pairing literacy and speech sound productions is only going to benefit him and help him improve this intelligibility and help him achieve these objectives that I've set forth for him. Lastly, I just wanted to go over, I've also asked to increase the dosage intensity as well as the frequency, given that he is almost 5, he's severely delayed, and that past therapy 2 times for 30 minutes wasn't really working for him. So I think he needs a little bit more than that, and I think that it would be beneficial for him to be pulled out for maximum support, that one-on-one emphasis on explicit instruction and scaffolding opportunities for him, and it would really help me monitor his progress and see if I need to increase or decrease support, or if I need to back up on the amount of sounds that I'm using, and just really help me see where he is phonologically and where are those phonological awareness skills, and if I'm helping him overall. So let me know if you have any questions. Thank you so much for your time.